Nope, we still got a few folks coming in, so I'll wait a few seconds. All right, so we'll go ahead and get started. Hello, and thank you for joining us here tonight. My name is Reginald Parson, and I'm the Deputy Director with the Maine Paid Family and Medical Leave Program, and I'll be moderating and leading tonight's listening session. With me is my colleague Jess Picard, Communications Director with the Maine Department of Labor, and also present on the call is Luke Monahan, Director of the Maine Paid Family and Medical Leave Program. Before I go further, I would like to state that tonight's listening session will be recorded and posted on the department's webpage on paid family and medical leave. Tonight, we are looking for your input pertaining to any provisions outlined in the paid family and medical leave legislation, and is an opportunity for members of the public to identify areas that need clarification in the legislation. These questions and areas needing clarification will be used to inform the official rulemaking process, which will begin in the spring. Again, this informal listening session does not replace and is in addition to the formal regulatory process governed by the Maine Administrative Procedures Act. For this particular listening session, the department will not be providing a brief overview of certain components of the legislation, but instead dedicating all of the time tonight to hear from attendees who wish to offer comments. Participants who wish to comment will be allowed up to 2 minutes. To be recognized, please use the Zoom raised hand function and you'll be called upon by a staff member assisting with this event, and the 2-minute time clock will begin. If all questions and comments provided during the comment period have been exhausted prior to 7 p.m., the event will conclude. Given time constraints tonight, we please ask to keep your comments only on the legislation itself, and any questions directed to the department regarding the substance within the legislation will come through the official rulemaking process in the spring. We encourage you to visit the department's webpage on paid family and medical leave, where you'll find up-to-date information such as a PowerPoint providing an overview of the PFML law, along with a timeline that outlines key implementation dates and a frequently asked questions document. You can find this by going to www.maine.gov/labor/PFML. With that being said, we'll begin tonight's event. And so individuals who want to offer comment, now is the time to do so by raising your Zoom hand. And Jess will recognize you.
All right, I see Anne has raised her hand, so I'm going to move you in. Hi, Anne, can you hear us? If you're talking, you're on mute, Anne.
I'm sorry, can you hear me now?
Yeah.
Hold on. So I just wanted to make a comment. I don't really have a question. I just wanted to say how fortunate we are to have this new program in Maine. About 10 years ago, when my sister, who lives alone, needed to have hip replacement surgery, I went and stayed with her for about 2 weeks. I was lucky that I had some vacation time to use and could also work remotely for part of that time. But I'm sure there are many Mainers who might find themselves in a similar situation. And it's just gratifying to know that going forward, they'll have some help available to them through the paid family and medical leave program. And that's really all I wanted to say. Thank you.
Thank you.
Anne. Okay, and Ronnie, I'm going to move you in.
Hi, everyone. Thank you. Yeah, my name is Ronnie. I use they, them pronouns, and wanted to share I'm a resident of Lewiston. I'm an organizer with the Southern Maine Worker Center. And just, yeah, like Anne wanted to share just a lot of enthusiastic support for paid family and medical leave. This is such a crucial protection that Maine workers have needed for so long. We've earned it. And I wanted to also continue to push for a public program that is administered by and for the public, not by private for-profit insurance companies. I think this is a really important thing. I wanted to say that we represent we have about 300 active members. We have thousands of supporters across Southern Maine. The mission of my organization is to improve the lives and working conditions for poor and working class Mainers. We were part of the coalition that advocated for this. And yeah, we're really counting on this authority now to implement the policy effectively and in solidarity with the workers who need it most. I think that's why it's so important to administer the program through a public institution that's rooted in our own community, like our own Department of Labor. I wanted to share that there really is no evidence that privatizing the administration of a paid leave program would save money or increase efficiency. It's actually much more likely that a privatized insurance plan would lead to bloated or increased administrative costs for Mainers. It will also definitely lead to cut corners, the loss of public control, the loss of transparency. It will lead to erroneous denials and unnecessary barriers and hurdles for working people trying to access their benefits. A dozen of the 13 states who have passed paid family medical leave have already modeled how to implement it without privatization. I also wanted to just push y'all to keep doing lots of public education as much as you can. I think that's a big effort too, and I think it's something that we can all take on together and to work with the community and proponents to make sure that information is getting out and to push for just more diversity on the authority. I'm a person of color, and I'd love to see perspectives and identities like mine reflected in these decision-making bodies so that, our experiences just aren't left out. So thank you all so much.
Thank you.
Thank you.
All right, Jared, I see your hand is up, so I'm going to move you in.
Hello, are you able to hear me?
Yes.
So my name is Jared Make, and I'm Vice President of A Better Balance, a national legal nonprofit that has worked on every state paid leave program. I was appointed to Colorado's Family and Medical Leave Insurance Task Force in 2019 that informed our state's program and endorsed public administration, given the costs and risks of outsourcing. I want to express deep concern with outsourcing of claims administration. Given its built-up infrastructure and experience, a private company will have huge leverage to make demands and increase future contract costs. Also, governments that have taken back outsourced operations generally cite poor service quality more than other reasons. Not a surprise, since service quality often decreases when profit is prioritized. And the only state with such paid leave claims outsourcing, Connecticut, actually has a higher administrative cost ratio than other public leave programs. At the same time, a large penalty was recently levied against their administrator for failure to meet key performance metrics. If such outsourcing does occur in Maine, significant oversight and staffing is still essential, adding costs on top of a costly third-party contract. First, the state must have dedicated staffing for oversight with regular review of claims processing activities, rigorous audits of the administrator's operations, and data privacy reviews. Second, the state needs dedicated IT staff to learn and monitor IT operations, as well as contractual co-ownership and co-development of software and tech platforms, which is essential to ensure continuity in programming if the contract ends. And third, the state must retain core functions like rulemaking, fund finances, and oversight of private plans under Section 850H. The state must also have staff to hear benefit appeals, ensuring timely review of the administrator's determinations, and enforce employment rights. In conclusion, even if Maine outsources administration despite the risks, the state will bear large costs for oversight, enforcement, and continuity of programming expertise if a third-party contract ends. Thanks so much.
Thank you.
Right. Abby, I see your hands up. You will be next.
Hi, can you hear me?
Yep.
Yes.
Hi, this is Abigail O'Connell. I work for Sun Life. Sorry, I'm calling in from just dropping the swim carpool. So it took me a second to get off mute. I'm an attorney. I work in-house at Sun Life, and we are both an employer in the state of Maine, and we're also an insurance company. And I do not have a position on privatization at all. I know that private plans are part of the program so that if there are employers who potentially are already offering PFML, they would be able to establish a private plan and opt out of a state-run program. And I'm not here to talk about either privatization or private plans. What I'm here to talk about is having lived through this in many other states. And I would encourage rulemaking to happen cohesively rather than in batches. And we have seen batch rulemaking in other states like Oregon and Colorado, and it's resulted in like an ever-changing rules on specific topics. And I would suggest that it's easier to do it all at once when you're actually outlining the rules or regulations to run the program. I would also love if there could be any coordination between rulemakers in our industry. So not just Sun Life, but the industry of disability insurance and paid leave providers who offer private plans. Based on our experience, we have learned a lot of lessons and have a lot of valuable insights. And I think we are probably your best free source of expert labor to review any draft regulations and provide feedback. So I look forward to working with you guys through the ACLI and other industry working groups, and appreciate the opportunity to speak. Thank you.
Thank you.
Curtis Picard, I see your hands up. You will be next.
Good evening. Can you hear me?
Yes.
All right. I'm Curtis Picard with the Retail Association of Maine. Thank you for the opportunity. I've participated in a number of these. I'm going to hit on things I haven't hit in previous sessions, and I'll go kind of chronologically with some section numbers as well, which hopefully you'll find helpful. Section 850A, subsection 19G. This is a section where a covered individual can identify an individual that they have a significant personal bond with. I recall during the discussion of this law, the intent was that a covered individual would be able to identify one person per year. And we just want to suggest that clarification should be made in the rulemaking. Moving on, same section, 850A, subsection 27. This is the self-employed individual definition, and we just wanted to clarify, our reading of this talks also about limited liability companies, limited liability partnerships. We know the intent was for, independent contractors to be able to participate. We don't think the intent of the law was to, in essence, maybe absolve a small law firm from having to pay the employer share of this, but I think the way it reads, limited liability company may get out of paying the employer share of the funding. Moving on, section 850B, subsection 5. I may have mentioned this one before. This is the section that would require leave of not less than 8 hours. And I think we've brought up before that how are we going to handle part-time workers that work shifts less than 8 hours? Same section, 850B, subsection 11. we have a little confusion here. Our members have some confusion here regarding how Maine's paid family leave law is going to work concurrently with federal FMLA law, which can sometimes be unpaid as well. Would an individual be able to take both the paid Maine law followed by unpaid federal? Section 850D, this is the section that requires someone to apply for funding and the notification to employers. And we're just curious to understand how this is going to work in a real practical situation. It says that employers are going to be notified within 5 business days after some leave has been approved. An employee has up to, I believe, 90 days after the start of leave to apply for leave. We're just not sure how employers are going to be notified. Is it simply going to be an employee doesn't show up for work for any number of days, but they may not know whether or not they're actually taking leave. So I think that's something that needs to be clarified. And then lastly, section 850F and G. This is also related to self-employed individuals. Both of these sections talk about self-employed individuals may electing coverage, and especially under 850F subsection 10, this talks about how a self-employed individual can elect coverage, but if they fail or refuse to make premium contributions, we're just curious. The way we're reading that makes it seem like a self-employed individual could not pay their premiums, but then decide to take leave. And as long as they get current on their premiums, then they would be able to take leave. We're not sure if that's the intent of the law, but it was something we picked up in our reading of it. So we're just not sure, what does elect coverage mean? And my final comment is, are these benefits going to be taxable? And I think that may have been brought up in earlier sessions as well. But that's all I have, and thank you for the time.
Thank you.
Okay, and I am not seeing any hands up currently. Oh, Bethany, now I do, all right. All right, Bethany, you are good to go. You're trying to speak, you're on mute.
Hi, my name is Bethany Allen. I own a small business in Bodenham, Maine. We're a medium-scale organic vegetable farm, and I was really proud to advocate for this program and I'm excited to see how it improves the lives of Mainers. In terms of the practical reality of the program as a small business, I have just a few thoughts that might help in rulemaking, or just thoughts that have come up. One is I'm assuming that it would integrate well with a payroll service, but I know many sort of small employers, farms included, that don't utilize a payroll service. And so and do a lot of their work by hand. And so making sure that the simplicity of the program and having very small employers pay into it is an easy process for them as a small employer. I would also encourage rulemaking to consider how the program handles seasonal employees and people whose wages fluctuate a lot from year to year. As a farm, we have years where we make no money. We have years where we're making quite a bit more money. And as a seasonal worker in Maine for many years, there were seasons where I was only working 20 hours a week. There were seasons where I worked 60 hours a week. And I would encourage rulemaking to consider how employers who are not paid an hourly wage or a salary, or workers who have greatly varying schedules throughout the year can be affected by the, can take advantage of the program and exist fairly within it. I think that's it. Oh, and lastly, I would also encourage this rulemaking to consider seasonal guest workers and what the rules might be for paying into it for H2A and H2B workers. They currently they only pay some taxes, but obviously can't access a lot of the federal programs, like don't pay Social Security, but they do pay other taxes. And so considering that there are probably a lot of seasonal workers in Maine that are guest workers from other countries, I would encourage rulemaking to think about whether or not they should be taxed for this program if they cannot access it. Thank you. That's all.
Thank you.
Melissa, I see your hands up. You will be next.
Good evening. Are you able to hear me?
Yes.
Great. Excellent. My name is Melissa Martin, and I'm making comments tonight on behalf of the Maine Coalition Against Sexual Assault, also known as MICASA. We are the organization that represents and serves Maine's sexual violence prevention and response programs, as well as Maine's children's advocacy centers. And we're here today to express our strong enthusiasm for paid leave in general, and specifically for the safe leave that will benefit many survivors of sexual violence. And at MICASA, one of the things that I wanted to point out is that we conduct an annual needs assessment where we survey all of our statewide sexual assault advocates about the greatest needs that survivors of sexual violence face. And in the past year, the greatest concern has been basic needs such as housing, food, and healthcare. We also know that the CDC estimates that the cost of a sexual assault is over $100,000 per survivor. And so we're just really, really enthusiastic because paid leave helps address all of those, financial needs of people who have experienced sexual violence. There are two things that we are hoping to point out. So one, the way that safe leave is designed in the current statute allows people to take, increments of time when they might be preparing for a court proceeding and they have to, meet with an attorney and then go to a court proceeding. And so we would just encourage you to think about the fact that there could be survivors who are taking sort of these interval chunks of leave. And if there's a way to streamline the application process so that they can maybe do a single request for multiple events where they need to take paid leave. Our office is always available and willing to be of technical assistance to sort of think through ways that the administrative burden can be lessened on survivors and to make the process as trauma informed and accessible as possible. The only other thing that I want to point out, I previously was an attorney working in legal services. And in that role, I frequently supported survivors requesting the current unpaid version of safe leave. And one of the things that I noticed was that a lot of both employees and employers were really unaware of that system. So I was often, asking survivors, are you able to take time off to go to this court date? And they were often experiencing pushback. And I think a lot of that was lack of knowledge. And so just putting in a push to make safe leave something that we really highlight so that survivors know that it's available and that employers know that it's available as well. And again, our coalition is happy to support in any way possible to get the word out about safe leave. Thank you so much.
Thank you.
Oh, oops, hold on. We lost an interpreter. 1 second. Okay, so. Jake, I see your hand is up. You will be next.
Hey there, Reggie, good to go?
Yep.
Perfect. My name is Jake LaChance, Government Relations Specialist with the Maine State Chamber of Commerce. Reggie, always good to see you, sir, as well as your compatriots there over at the DOL. Just wanted to say that I've taken part in all the listening sessions that have happened so far, and I really appreciate you folks getting to hear from folks that live here in Maine and work here in Maine about the issues that are happening here in the state. So I really appreciate you folks giving the opportunity for that. We're obviously going to be sending and have been in contact with you folks at the DOL. So I'm not going to belabor too much here because you'll be getting a lot of things in writing as promised earlier. But one thing that I just wanted to reiterate that was said in prior sessions is I think it's really a priority for not only the new authority that was just nominated and confirmed by the governor, but also the business community as well as the employee community here in the state of Maine is really putting an emphasis on making sure we're doing this implementation process correct the first time, and taking the time and due diligence to making sure that through this rulemaking process that things are squared away and implemented to be of best service to the folks in the state of Maine as possible. And I think we've seen in a multitude of other states that there have been delays from the original timeline of these implementations. And I think that's a sign that these other states are really taking this seriously and making sure that they're putting forward the best product possible. So I would just encourage folks through this rules making process to really make sure that the time and care is going to be taken for that. I think the authority is a really, really great collection of folks that will do a really good job. But if this ends up in the time frame that's given, being something that does need a little bit more time, other states have really used that as a framework to make sure that these programs are able to be implemented in the best way possible. So again, I really appreciate the time and for the DOL and you folks to be doing these sessions, and we look forward to the next year and beyond of how this is going to be shaking out. So thanks again, Reggie.
All right, thank you.
James, I will be adding you in.
Hey everyone, can you hear me?
Yes.
Yes.
Okay, great. My name's James Mile. I'm a policy analyst with the Maine Center for Economic Policy. I'm also a member of the State Family Medical Leave Coalition here in the state. I think I wanted to build partly, I guess, building on what the last speaker said, which was I think it's important for you guys to learn from some of the experiences of other states, and I have a couple of suggestions kind of along those lines. One is that I think as you guys go forward with the education process, particularly, I think sort of showing the ways in which the paid family medical leave programs in other states have been successful, I think will be useful both for workers and for employers. I'm going to suggest sort of longer written comments on these lines, but I think there's a fair amount of evidence that shows that, you know, the experience, the best programs that are put into place have actually generated really positive experiences, both businesses and workers. And I think those are things that, you know, we can draw on to make sure that our experiences are good, but also I think to help reassure some folks who may have misgivings about a program that's relatively new, to kind of show them the ways in the other point that I wanted to make was I did see on the frequently asked questions document, I think one that you guys posted recently, it said that the initial rate for the contributions was going to be set at 1%. I think the statutory language says that the department can set the rate up to 1% for the first for the 2025 period. And so I do want to just highlight that I think you guys may have some room there to set the rate lower. Again, sort of in my written comments, I think there's a good case to be made that it doesn't need to be as high as 1% for the first year. Although I appreciate that actuarial studies that the study commission did for this don't line up exactly with the final policy that was implemented. I would say that the policies that they looked at should all come in at a higher and more generous benefit total rate because of the way that they were structured and the way the final policy was structured. And so I think, you know, looking at the examples of other states, I think 1% is probably on the high side of what needs to be decided. But again, I'll send in a written version with kind of some of the math laid out for that. And just wanted to flag that for you guys.
Awesome, thank you.
And Reggie, this is the interpreter speaking. I just wanted to make sure that both of us are being seen on the screen. I can see in your owl that sometimes it's just my blank screen. I just want to make sure the recording will be able to catch both of us.
Okay, that's a good flag, thank you. Please give us 1 second, we just want to air out some technical stuff. Great.
After highlighted, spotlighted on mine, but it's not showing up on the main one.
Yeah, okay,
Yeah, try it.
okay, all right.
Yeah.
Okay. We're all good? Okay, all right, great, thank you. Sorry for the minor delay, we just want to make sure that both interpreters were spotlighted. Okay.
Okay, and I'm adding the next person in. Okay, whenever you're ready.
Okay, great. Hey, good evening, everyone. Thank you for taking the time to host these sessions. I've listened to a couple of them, but have not commented yet, but really appreciate the public engagement piece here. My name is Tobin Williamson. I live in Westbrook. I work with the Maine Immigrants' Rights Coalition. And so just a couple of things that I wanted to raise. One, my wife has recently taken a job that's fully remote, but working for an employer that is based in Washington, D.C., but we will be still living in Maine. And I'm sure there's some, you know, that sort of remote work has been considered for working for companies that are based in other states and other districts. But I just wanted to, you know, lift that up. I'm sure there are plenty of folks that live in Maine that are in that situation. And so I just wanted to lift that. And then my next point just, you know, is working for an immigrants' rights organization, you know, just really advocate for continued use of language access, translations and interpreters as needed in terms of public engagement pieces and input and output and things like that. You know, I know that you guys have prepared multilingual documents so far. Just wanted to continue to impress upon y'all the need for language access for folks that don't speak English or don't read English or don't read it very well. So just wanted to raise that up. And then finally, just my last point is a desire to see you know, more consideration for immigrant employers and employees in terms of like serving on the commission or being a part of the authority and things like that. You know, certainly that's a vital part of Maine's economy, and just wanted to make sure that those voices were considered throughout this process. So yeah, that's all I have. Thank you very much.
Thank you.
All right, and Nate, I'm going to add you in next.
Hi there, Nate Cloutier, with Hospitality Maine. We represent restaurants and lodging establishments of all sizes across the state. Really appreciate the opportunity to weigh in here at the final work session, or the final listening session, rather. I think hopefully these have been productive for you as well as they've been for us as you craft these draft rules. A couple of points I just wanted to hit briefly are while the bill was being drafted, there was talk about having an actuarial study before this became law that would be more specific to the numbers that would be used. I said previously at a different listening session that the Minnesota actuarial study came in about $600 million short over 3 years, over a 3-year span. Luckily, the Massachusetts director actually moved to Minnesota and is helping oversee that. So he's has some experience in setting up a program there. But I think one of the key things will be an early actuarial study. I know that the Paid Family Leave Coalition did a study in 2021 or 2022 that had some figures, but I think it's worth now that we have the law established, doing an actuarial study with some concrete numbers. In regards to privatization or having this being managed through the Department of Labor, state vacancies those positions are at an all-time high. They can't find the people to fill those jobs. There's legislation right now in the State House to try to find ways to incentivize more folks to fill these positions that are unfilled within the state. My concern is that we're going to set up a program, and if it's administered through MDOL, that might not have the capacity to really responsibly and efficiently manage this program if they can't find the folks to oversee it. And I think that, there's value in hiring outside expertise could be a practical choice there. Washington State, as it was stated by somebody else, has their program that's managed through the state and not privately. They had an initial goal of setting applications to be processed within 2 weeks. I just recently read an article that said that their lag time is almost to 5 weeks in processing those applications. And it's going to be, obviously, when you're going for this leave, you are wanting a quick turnaround on being able to take that leave. I appreciate too that the topic of H-2B and H-2A, or workers who aren't here permanently, what their role and contribution would be. That's something that we raised during the public hearing process as well. I think it's important to think about how long on average these workers are here, and are they getting any return on investment by contributing to the program. I think that was a great point brought up by somebody else. I think there'd be value in having the director or somebody from the department meet with other directors from across the country that have implemented this, and trying to get, what went well, what didn't go well, and how can we learn from that. The final thing I'll say is I think it's important to set expectations early on what information is going to be accessible to employers, and making sure that employers do have a certain set of necessary information to just bridge the gap between employers and employees once that leave is taken. And I'm not talking about like anything egregious or the tip of protected, but it's important to make sure that employers aren't left in the dark once leave is taken. I said that was my final point, but the last thing I'll say is that I believe the bill has, or the law rather, has a provision in it that if there is any malfeasance or willful abuse of the program, that the penalties that they're kicked out of the program for a certain period of time, and then they'd be for maybe a year, and then they'd be re-eligible to be back in the program. Elsewhere in the Maine Department of Labor, they just recently advocated for stronger strategic enforcement and penalties as the primary deterrents to potential bad actors. So we just recommend carrying that mindset over to the Maine Paid Family Medical Leave Benefits Authority. Thank you for listening to us once again this evening.
So thank you.
Okay, Gina, you are next. I will add you in.
Hi, can you hear me?
Yeah.
Yeah.
Wonderful. So my name is Gina Rutledge. I work at MetLife, who is both an insurance carrier, and we do have valued employees working in Maine. So we will be providing this this benefit for them. My comments today are going to be on the rulemaking process. I also grew up in a family with a small business. My father was a tractor mechanic. We sold farm implements. So it was very much a small business that had at any one time between 10 and 50 employees, depending on the season. So a lot of our comments for regulations ask you to look at that business, the small business person and their ability to look at all the different employment laws. So during regulations, understanding how the new paid family and medical leave will align with your sick leave plan, looking at how it will align with the unpaid family medical leave requirement under 88 or 844. Those things really can be confusing to the small business owner trying to make sure that their employees have all the benefits available under the work state, but still have people at work to support the small businesses. Many of your laws already, your unemployment, your workers' compensation, these unpaid family medical leave, the sick leave, they all have really clear definitions of employers and wages and those particular items, if we could reuse those in the paid family and medical leave regulations, it will help everyone understand when someone would apply for benefits, especially if they overlap. And my one last thing is I do agree with Abby that recommended doing all the batches in one instead of trying to take and separate out rulemaking. You can see that for your programming of systems, having one batch to refer to so that claim administration runs smoothly will be a very big value add for your claims administrator, whoever it may be. I have no comment on that. But thank you for your time. We are here to help. And if you have any questions, I know that ACLI or a lot of these listening sessions have had some really good feedback from smaller businesses as well as, many different stakeholders. So thank you.
Thank you.
Okay, Bridget, you are next. I will add you in.
Hi, good evening. My name is Bridget Quinn, and I'm calling and speaking on behalf of AARP Maine. And tonight, I just wanted to raise to the Department of Labor during the rulemaking process, just the ask that we ensure access to this program for all Maine workers, including our direct care workforce. We know that Maine's facing a direct care workforce shortage due to a significant and historical undervaluing of care work. This is due to low government reimbursement rates for our direct care workforce, meaning workers are paid low wages and face high rates of poverty, financial hardship, and burnout. And part of that means a lack of access to workplace protections and benefits such as paid leave. Paid leave is really important to this workforce as many are caring for their own children or providing care to their families and may need access to time off. Paid leave is a tool that will help Maine reduce staff turnover in our long-term care settings and support our direct care workers who are managing family caregiving, as well as allow the state to promote economic security and advance equity. We do recognize that there are concerns that have been raised regarding employers funded primarily through MaineCare in covering the cost of paid leave without a change to reimbursement rates for these organizations. And we just want to raise that we know that implementing a paid leave program is going to require some creativity from all of us, but the priority should be and must be to ensure that all workers have access to this program as soon as it is launched. Any less than that would be an injustice to Maine's direct care workforce, and just wanted to thank you for the opportunity to provide care comments this evening.
Thank you.
Okay, and I'm adding the next person in.
Hi there, good evening. My name is Desti Homan Sprague. I am here this evening on behalf of the Maine Women's Lobby, as well as the Maine Paid Leave Coalition, and I've spoken at a couple of these, so you are probably familiar with the coalition. Thank you so much for your hard work that you're doing pulling these together. We really appreciate it and appreciate the frequently asked questions that you just shared yesterday. I want to focus my comments on the need and import for community education and outreach regarding the program. And I was really glad to hear a couple of the previous speakers mention this, especially my colleague, Mr. Cloutier, talking about ensuring that workers and employers both have the same good information. We've seen in implementation in other states that prioritizing the role of education and outreach needs to be a core duty of the program implementation, not an extra. And so our hope is that you will focus dedicated communications resources on community education about the program, not only now, but throughout rulemaking and implementation. A couple of best practices I want to highlight. First, that this should have a dedicated, robust communications plan with ongoing, timely information and updates provided through multiple channels. The idea that well-informed employers are the key to a successful program. There's a lot of good research that shows that employers that embrace paid leave programs are the most valuable people to educate employees about that work. We know that government has a role in enforcing workers' rights to job protection, but in practice, those protections are only as strong as employers understand them to be. And so making sure that employers and workers both have a good understanding of the program and their rights is essential for people to be able to access those rights. It's also the strongest prevention against potentially discriminatory practices. There's also good research that shows that low-wage workers are the ones most likely to not participate in the program when there isn't robust communication and education. There's a clear correlation between outreach and uptake among low-wage workers, and that there's good evidence that connecting that outreach with other efforts to connect with low-wage workers or marginalized workers, such as SNAP education, can be really effective. The last thing I want to share in this vein is that strong education efforts can establish the department as the trusted authority on the program. We actually saw in New Jersey, when they did not have a strong public education component of their administration, that third-party players and coalitions stepped in. Even though those actors, like our own coalition, were working hard to fill the gap, it meant that the information was diffused, it wasn't always accurate, it wasn't targeted or available to the folks who most needed it. And that problem grew with time. As information networks got less reliable, it was almost impossible to provide program updates. And because the administrator had not established themselves as the trusted resource, they weren't able to move back into that role once that gap was identified. So I have a lot more research that I'd like to share with you about some specific best practices. I will follow up over email, and I'm really grateful for the opportunity to speak here with you tonight. Thank you.
Thank you.
I'm adding the next person with their hand up into the meeting.
Hello, can you hear me?
Yes.
Hi, my name is Nikita Sabino. I am from South Sudanese community. I'm the chairperson of South Sudanese community in Portland, Maine. I really appreciate you for making this section happen for us to understand the rules on the regulation of Maine Department of Labor. It's really, really great for our community to be able to understand the benefit of this program. And I'm here tonight to testimony about why it's important for our community and immigrant as well as refugees and asylum seekers. And why it's important for us. And immigrant often, they faces unique financial challenges, including language barrier, credential, recognizing the issues and limit access to support the network. Paying family leave can provide economic stability during the critical times, such as when they're caring for newborn or sick family member or dealing with personal health issues. This stability can essential for immigrant families and thrive. They contribute positively to their community as well as for the economy. I believe this is really great program for them, but the only things that I want to ask, like how the community will be able to benefit and how they will be getting the clear information about this. There's a lot of people in my community that work, they don't understand the policy and family leave and how they can get paid for family leave when they sick or when they having some critical condition that they facing. So I'm just here to see if there is any way that you can reach out to all the members of the community of all those organizations and other communities around here, and to be able to give them information about this program so they can be able to share it with their community and explain it to them in their own language that they can be able to understand. Because of lack of language, is very difficult sometimes to signing up paper and not understand what's going on with this paper. And at the end, when you get hurt at workplace or you have to leave because of sickness, you don't, they will give you a paper that you already signed a while ago when you get hired, but you don't understand the policy on it. And I think it's great is to share this with the leaders of the community so they can be able to explain this in their own language, as well as I know there's some metalingual people who can be able to translate that, as well as Catholic Charity, I believe, too. And other things also like in public education, that will be great. So, and with the interpreter for them to be able to understand what is the role of Maine Department of Labor. So I just want to say thank you for offering this section, and I really learn a lot from it. I look forward to get this implemented in future. Thank you.
Thank you.
Thank you. Okay, and I am not seeing more people with their hands up. If you have a comment, if you could please put your hand up. All right, I see Kate. I will add you into the meeting.
Hi, can you hear me?
Yes.
Yes.
Thank you. Thank you so much for the opportunity to comment tonight and for everything you're doing to set this program up for success. My name is Kate Blackford, and I am the Public Policy Director for the Maine People's Alliance. I want to share tonight our excitement about the implementation of this program, the results of a recent survey that we did of our members, and a few comments on the program administration. As you know, and as clear tonight, we are not the only ones who are excited about this program. Paid leave is broadly popular across Maine. Polling last year showed that 95% of Democrats, 85% of Republicans, and 90% of independents support the creation of paid leave. Business owners and managers also broadly support creating a program, and that support it just really remains strong despite sort of different attacks on it. And these findings aren't new. They align with feedback that the Paid Leave Commission received, with polls that were done in earlier years, and with our experience and our partners while collecting signatures to put a similar proposal on the ballot a couple years ago. The work you're doing matters so much to so many people. Thank you so much for all that you're doing. And of course, that doesn't mean that people don't have questions and ideas for how implementation should look. When we surveyed our members this month, we asked employers, employees, the self-employed, and retirees about their top considerations. And they had 3 top priorities that really rose up. One is setting up a simple and accurate system for employers and the self-employed to be able to make contributions and for everyone to apply for benefits. That people can take new paid leave benefits without facing negative consequences at work, and how the Department of Labor reaches out to employers and employees and educates the public about how the program works and what to do when you need to contribute or apply for benefits. And those really make sense, right? Of course, people want the system to be simple and easy to use. They want to understand it. And as we know from other states, that without clear job protections, workers won't take leave even when they need it. A 2012 U.S. Department of Labor study found that among employees needing leave for qualified family and medical reasons, but not taking it, the fear of losing their job was the second most commonly cited reason behind unaffordability. And that is a really important protection that is built into the law here in Maine, but just want to make sure that it's a core part of the rulemaking that you are putting forward. The next tier of concerns that folks had were that employers have the support that they need to set up the new program and when staff members take their leave, and that the program is well managed and costs of administering it are kept low. And these, of course, also really make sense, and I would argue are broadly held priorities by everybody. All of us want to make sure that the program is well run and employers have the support that they need to participate, especially that clear information about how the program works and what their responsibilities are. And the data and stories from other states show that robust paid leave, when it's implemented well, has really tremendous benefits for everyone, and we know that you hold these priorities as well. Part of ensuring these outcomes is making sure that the program is administered in a timely, accurate, and easy to use way. And while Maine has the option of outsourcing the benefits administration under current statute, the Paid Leave Coalition would like to raise concerns about that option, which you've heard from a few folks already tonight. In the one state that used the privatization model, privatization led to higher costs and less effective program delivery. And we would strongly urge the department to implement this program as a public insurance plan administered by and for the public, with strong oversight and clear metrics for what's considered successful administration. Overall, states' experiences administering the program have been very effective. The administrative costs have remained low and program outcomes have remained high. Administrative costs in Many states are quite low, and in 2020, the administrative costs in California were 4.3%. And administrative costs in the private sector run much higher. For example, they sort of range from 13 to 19% for private plans when you look at healthcare versus public, 2% when you look at Medicare. So we know that from other programs that having a private administration raises those costs significantly. And that makes sense, right? Because for-profit businesses are fundamentally organized to make profits. And by adding a built-in profit margin to the program administration, we raise costs for employees and employers. That was the experience in Connecticut. Their contractor failed to meet performance standards, had high erroneous claims denial rates, and overall the administrative cost was nearly twice that of other states. And more than 75% of the claim application denials were due to incomplete applications or not receiving the required documents. And numerous reports attribute the high rate of denials to the program's confusing application process. We know that even under public administration, the Maine Department of Labor is still in a position to assess the best opportunities to contract out aspects of the administration and implementation. So whether that's around IT development and maintenance to call center staffing, that there are lots of different options which might be able to address some of the concerns that both stakeholders and the state have expressed in terms of being able to hire up and get ready for program rollout. So there are options to consider while still preserving that strong public oversight and clear metrics for success. So we know that you're working really hard on all of this, and we're so grateful for all of that. And thank you so much for the chance to comment tonight. Appreciate it.
Thank you.
Okay, and I'm adding the next person in. All right, can you hear us? Whenever you're ready.
There, that must be better. My name is Jay Nalaboff, and I'm a member of the authority, and I just wanted to thank the department and you all for holding these sessions, and thank all the people who've called in and given their opinions. And I think it just will emphasize, it emphasizes for me how crucial the rulemaking process will be, and how we have to do this deliberately and get input from other states, information from other states and other stakeholders, so that we do this right the first time, and that we're not trying to backfill and make up for shortfalls and things later. So thank you, everyone.
Thank you.
Okay, and I am not seeing any more hands. If you'd like to make a comment, please raise your hand. Anyone have a comment? All right, Dusty, I see your hands up. I will bring you in.
All right, hi, it's Dusty Homensprigg again. I know I already spoke, but I did notice that sometimes that happened in the last ones, so I hope it's all right that I'm going ahead. While I was here listening, and particularly ruminating on some of the comments we've heard over the last several weeks about concerns about the employer burden, I did a little back of the envelope math, and I myself, an employer, I employ 4.5 FTE, and have a payroll of about $350,000 a year. And so I just did the math. We do currently offer 12 full weeks of paid family and medical leave because obviously that's an important part of our values. And in order to pay one staff member a 12-week leave, I set aside $16,000 a year for that. Our entire payroll contribution under this program will only be $1,500, so less than 10% of what we're currently paying. And I just, for folks who are still maybe listening and like are worried about the burden, I really understand that as a small employer myself, and just want to like encourage people to sort of do the math on what that payroll is and what it really looks like in terms of the overall burden versus the really real benefit to families and communities. So thanks for letting me chime in again.
Thank you.
Hey, anyone else who would like to make a comment, just put your hand up.
Seeing no other hands, we're just gonna give it maybe a couple of more minutes if there are no additional hands. We can end, but I'll give folks till 6:40. There are no other.
Give people one more minute.
Yeah,
If
one
you-
more minute.
If you have any comments, even if you already spoke and have something else that you wanted to say, just stick your hand up. If not, we will adjourn a little bit early.
I guess we
I think
can.
we're good.
All right, so seeing no other hands at this time, I want to say thank you to those who attended not only tonight's event, but the other listening sessions that we've had on paid family and medical leave. This has been very valuable and helpful information as we continue forward in the implementation process. But in the meantime, we still encourage you to visit the department's webpage on paid family medical leave by going to www.maine.gov/labor/PFML on information that is currently posted. And again, we would also encourage folks, if you haven't signed up to be on the interested parties list, to do so. And you can sign up to be on the interested parties list by going on the PFML webpage by the department. With that, I wish everyone have a great night and take care.